If you're applying for disability benefits or help people that are, the path to success has never been more complicated. Welcome to the Disability Expert Podcast, where we tackle the difficult issues and interview the country's top experts to help you better navigate the disability process. Winning a disability case is hard and keeps getting tougher every day. We can't promise you'll win your case by listening, but we sure think it's going to help.
This really isn't that complicated. I mean, you want to win your case, don't you? Well, then listen to what I say.
Hey, so welcome to another episode of the Disability Expert Podcast. I'm Chad Brown. I'm your host. I'm so excited about my guest today. My guest today is Melissa Fowler. She is a longtime friend of mine, but is an expert on Medicare for the disabled. And it's actually neat. We're going to actually do a two-part episode today. There's just so much information to cover. I don't think we're going to get through it in one episode. So we decided to do two. And Melissa, so great for thanks for being on the show today.
Thanks for having me, Chad.
Hey, great. I'm excited. So let me tell you a little bit about Melissa, just so you sort of understand why she's here. She's a North Carolina and South Carolina licensed health, Medicare, long-term care, and life insurance agent. BS in political science from Appalachian State University. Was a paralegal certificate for UNC Charlotte. Worked as a paralegal for about a decade. Was a North Carolina board certified paralegal. Was an exceptional paralegal. I worked with her for a number of years. Most of her work, though, and related to how she ended up where she is today, was with Social Security disability clients when she was a paralegal, and now has been health insurance, Medicare specialty insurance agent since 2020, worked almost exclusively with disabled individuals on Medicare since then. She is my right-hand woman at CVIG, our insurance agency, and so wonderful to have you. Thank you so much. Real expert in the Medicare space where people have so much confusion that we sort of resolve on a day-to-day basis. So how did you get into the Medicare space? How did you end up moving from college to paralegal to end up being a Medicare agent? I'm assuming it's kind of like disability law. I say that all the time. People don't say, I'm going to go become a disability lawyer. I don't think anybody sort of goes to college and says, I'm going to be a Medicare insurance expert. So how'd that happen?
No, that was not my plan. I had been working as a disability paralegal after I had my second child and out of work. During that time frame, CVIG was open. And I went back to work for a little while at the law firm, just doing part-time work. During that time, started learning more about the insurance agency and Medicare, and I saw the impact it was having on our clients, how much it was helping our clients, and I got interested in it. And after a lot of discussion, decided to get my insurance license.
So for people who don't know, what is CVIG as a company? What is CVIG as a company? What do they do? I mean, you work for them, but what's the company all about?
So CVIG is a Medicare insurance agency. We work with all individuals that are eligible for Medicare. We predominantly work with those that have been proven disabled by the Social Security Administration.
Okay, so CVIG works when people become disabled. They get Social Security disability, they get Medicare. CVIG specializes in that. So let's go through, because what I want to do in these couple of episodes is go through and really help people understand the Medicare component of their disability claims and be able to help them understand what the process is like from sort of getting Medicare, working through Medicare, making plan selections about things like supplements and Medicare Advantage plans. But that's way down the road. Let's start. What is Medicare?
So Medicare, it's a federal health insurance program, and it's for individuals that are 65 or older, those that have been diagnosed with end-stage renal disease or ALS, and also those that have been proven disabled by the Social Security Administration.
So at its most basic level, Medicare is federally provided health insurance.
Yes.
Okay, hopefully that's simple, right? Okay, so we know a lot about. Most people know that when they turn 65, they're going to be able to get Medicare. The other three categories you mentioned, I believe, are mostly related to disability in some context. Obviously, ALS and end-stage renal disease. And then when people get Social Security disability benefits, they do get Medicare. So you got your disability approved. Let's just say you're immediately eligible for Medicare. What's that actually mean? So when they say you get Medicare, it's federally provided health insurance, but what are you actually going to get when you get Medicare?
So when you become eligible for Medicare, you're eligible for Original Medicare. And Original Medicare includes Part A and Part B of Medicare.
Okay, so we're in the infamous Medicare alphabet where I
We're
know
getting
there's
into the letters.
lots of different letters, and I'm not sure anyone knows what actually any of those mean. But at a very basic level, what's Medicare A cover?
So, Medicare Part A is going to be mostly your inpatient hospital coverage, and it does include a couple other things as well. It includes hospice, some home health, and skilled nursing is covered under Part A.
Okay, so you have something happen to you, you have to go, you have to spend the night in the hospital. That's going to be under Part A. Okay, what about Part B? What's it cover?
So, Part B, that's going to be your general medical insurance. That is going to be where you go to the doctor, lab work, radiology, outpatient hospital, durable medical equipment, Part B medications, pretty much anything that isn't your inpatient hospital or prescription drugs.
Okay, I hear you. So we got Part A, which is hospital. We got Part B, general medical. But I didn't hear anything at all about prescription drugs in there. And you just said Part B is what's not A and what's not prescription drugs. So, I mean, I've represented thousands of disability clients. Every lawyer I comes on the show talks about their clients and their needs are, medical is both being able to get that treatment like you talk about in Part B, but also being able to get those prescription drug benefits they get. So what do they do? I mean, how do you get prescription drugs covered once you go on Medicare?
So we're going to get back into the alphabet again. So prescription drug coverage is going to come under Part D of Medicare, which is not part of original Medicare. That is something you were going to have to purchase separately.
Okay, so it's easy to remember, D as in drug, right? But that's not actually part of the federally provided health insurance. But when you become eligible for Medicare, you're able to buy prescription drug coverage through private carrier.
That is correct, yes.
So how does that work generally? So you just go buy a plan from the whoever it is, Aetna or Cigna or Humana or whoever you were working with?
So there's a couple options. So you can look at a standalone prescription drug plan, and the other option would be looking at Medicare Advantage prescription drug plans.
Okay, so person comes on disability, and they're immediately eligible for Medicare or some point in the future. They're going to get their original Medicare, which is A, which is hospital, B, which is their broadly general medical, almost anything that's not prescription drug benefits. And it's going to open up some doors for them to actually buy a policy that covers prescription drugs. Okay. All right. Well, I want to dive deeper into that because I know that's enough to show people where they're going, but it's really not enough to sort of educate them. But before we do that, we'll take just a minute and hear a word from our sponsors. So let's take a word from our sponsor, and then we'll be right back.
Hey there, this is Kevin Rosenquist from the Disability Expert Podcast. Every week, Chad and his guests discuss the disability process and how expert attorneys help their clients obtain the Social Security disability benefits they deserve. But obtaining disability benefits is only half the battle. After winning your disability case, understanding Medicare should be your top priority, and that's where CBIG comes in. Disabled individuals must get their Medicare coverage right. Trying to understand Medicare can cause anxiety, uncertainty, and even fear. CBIG works with Medicare beneficiaries on disability around the country and is committed to helping those on disability navigate the complex Medicare process. Visit cbigcares.com today to see how CBIG makes Medicare simplified. Mention this ad and receive a free gift when you schedule a 10-minute consultation.
Okay. Well, thank you there. Thanks for the word of the sponsor there. We're back with Melissa Fowler, who is talking to us about Medicare and what actually people who go on Social Security disability benefits receive with Medicare. We just got through talking about that they got Part A, which is hospital, B, which is medical. They have the option to get D, but I want to dive a little deeper into that so that people can actually understand, how do these parts of Medicare work? What do they cover? What do they cost? So let's just start with the alphabet. Let's go in order. Let's start with A. So you get your Medicare A. We've talked about it covering hospital insurance, but hospital treatment. But how does that actually work? Is there a cost to it? Is there a cost to use it? What are some of the pros and cons? Walk us through how this Part A works.
All right. So for Part A, for most people, you're not going to have a premium for Part A. And a premium, that's an amount you're going to have to pay every month to purchase the insurance.
Okay, so that's not about getting your coverage. That's just to have the insurance itself.
Yes.
The Part A doesn't typically have a premium.
For most people, no. As long as you were paid into the system, no premium for Part A.
Okay. All right. So you don't have to pay to use it. So if you go to the hospital, is it just free?
No, it's not free.
Okay, how's that work?
So every time you go into the hospital, you are going to have to pay a deductible, and it's every benefit period. So if you go into the hospital, that deductible is set every year. This year, it's $1,676.
Okay, so for people who may not know, let's just teach some vocabulary. Your premium
Okay.
is what you pay to buy the insurance.
Correct.
A deductible is what?
A deductible is an amount that you have to pay upfront before any copays, co-insurances kick in.
Okay, so you have to pay a premium to obtain the insurance, and a deductible is an amount you have to pay before the insurance actually starts working and helping you. And Part A has a deductible, so if you go to the hospital and you're there for 3 nights, for example, you'd have to pay that deductible before it would start to pay.
Yes.
So how does it work then? Do you pay a copay, or do you have co-insurance? How does it work after you pay that deductible?
So for the first, if you're in the hospital for 60 days, that $1,676 is what you pay. If you get to day 61, you start having additional daily copays on top of that.
Part A, you got hospital coverage. It doesn't cost you to get the insurance, but it's going to cost you to use it. Let's go to Part B. What about Part B? How does that work?
So Part B, most people are going to have a premium for Part B. The standard premium for Part B is $185 a month. Now,
Right.
if you are a high income earner, that may increase.
So average person on disability, though, they're going to be at the tier 1 cost for Medicare Part B, but they're going to have to pay $185, I believe it is this year,
Yes.
for your Part B premium. So let me just ask a practical question. Day in, day out, do most of the people who go on Social Security disability know they're going to have to pay for their Medicare?
They do not. No,
Oh,
it usually
well, okay.
comes as a big surprise.
Okay, so, and that's just to use the Medicare. Now, we're going to talk about supplements and Medicare Advantage plans and sort of this private insurance space in episode 2. But we're still under original Medicare. This is the federal health benefit that you get with Medicare. So what do you pay under Part B after you pay your premium?
So Part B, it's really simple. It's an 80-20 co-insurance. You pay 20%, Medicare pays 80%.
Okay, well, that seems simple enough.
However, with that 20% co-insurance, there is no cap during the year. And what that means is there's not a maximum amount that you would pay during the year.
Okay. So someone has, I don't know, whatever it is. Let's say they have some rare disease and they end up having to have a lot of treatment, or they have special medication or chemotherapy or radiation or whatever it might be, and they end up with $100,000 in medical cost. Real simple math, they'd have to pay $20,000.
They pay $20,000, yes. And any other treatment on top of that, they're going to continue to pay for that as well.
Okay, so in your opinion, generally with Medicare B, what are the pros and cons? Like, what's good about Medicare B? What are some things that maybe give you some concern for the disabled client?
The good thing about Medicare Part B is it's very easy. You pay 20%. You know exactly what you're going to pay.
Right.
It can be expensive, which is definitely one of the cons with it.
So how about acceptance? Is it pretty well accepted by most doctors?
Yes. So most providers take original Medicare, and you can see any doctor that takes original Medicare.
Is that going to be the same with Part A with hospitals, or most hospitals going to take Medicare Part A? Okay. So what's sort of the downside for Part B?
Downside is Part B can get very expensive, and if you have something like cancer, it can be catastrophically expensive.
So you have a simple pay formula, but because there's no cap on what you can pay for your co-insurance that goes with Part B, then you're exposed to 20% of whatever the bill is for that year. And so if that bill were to be, if it's $10,000, then you pay $2,000. If it's $100,000, you pay $20,000. Okay, very good. Well, that helps. Let's talk a little bit about Part D. It's not part of original Medicare, but almost anyone who's on disability is usually going to have some level of prescription drugs. So how does pricing work? Do you have to pay premiums for Part D? Where do you get Part D? What are some of the pros and cons for this drug coverage that most people need?
Yeah, so you are more than likely going to have a premium with Part D. Part D, so if you went with a standalone prescription drug plan, almost all of those are going to have a premium. And it varies from plan to plan, but generally you could range from probably about $30, $40 a month. So I've seen plans in the hundreds of dollars a month.
Right. And that's if you're buying just a standalone prescription drug plan.
Correct. Yes.
But you can also get a prescription drug plan as part, we haven't talked about Medicare Advantage yet, but you can get it as part of the Medicare in conjunction with the Medicare Advantage plan as well, correct?
Yeah. Yes, that is correct. And
Okay.
those
So-
premiums are going to be a little different. Generally, those are going to run from about $0 a month to $30-ish a month, depending on the plan.
So in the context of purchasing with the Medicare Advantage plan, a lot of times the premium itself, if it exists at all, will be lower. What about deductibles? How do those work with prescription drug plans?
This year, most plans do have a deductible. Not all of them, but most of them do. And it varies from plan to plan. Some of them are all of these drug plans have a formulary and different tiers of medications. And depending on what tier, you may have a deductible for that tier medication.
So, for example, if you're like in a generic blood pressure medicine that's tier 1, then that may not have a deductible. But if you're taking like a biologic that's a tier 3 or tier 4, then you may actually have to pay a deductible before that prescription drug plan is going to kick in and actually help cover the cost.
Yeah.
So what about exposure there? I know with Part B, we have this no cap, so there's unlimited exposure. I mean, some of these medications our clients take are really, really expensive. So are there any limits on what they would have to pay for prescription drugs under Part D plans?
That is a great question. And that has been a big change for 2025. There is now a cap on prescription drugs. So there's a $2,000 cap on any covered prescription medications.
Okay. So what are the pros and cons to Part D plans? Other than you can actually get one, which is a pro because you can get your drugs covered, right? So you at least have an option. But can you just real briefly, what are what's good about them and what are some concerns?
So the good thing is you're going to be able to get your medications. Medications are going to be covered. It may not be your specific medication in some situations, but your medications are going to be covered. The downside, some of those medications can be expensive, particularly in some of the standalone prescription drug plans. Those can get very expensive.
And I guess you have some premium cost and deductible cost, which are also adding to your overall expense. Okay, very good. Well, that has been a wonderful introduction to Medicare. We are, as I said in the intro, we're going to do a two-part show here because there's so much I want to go over with the Medicare. But we are at the end of our allotted time for show 1, so I want to thank you so much for giving us that intro to Medicare. Please stay on and watch episode 2 of this 2-part show where we're going to get into Medicare supplements and Medicare Advantage plans and actually how a Medicare beneficiary should go through the process to make sure that they both reduce their cost and maximize their benefits. So thank you so much, Melissa. We'll continue this conversation and thanks for watching the show and please subscribe.
Thank you.